Hi everyone, I am Dr. Aman Salwan here. I am a senior consultant intervention cardiologist at Care Hospitals, Nampally. Today I would like to talk to you about the risk factors for heart disease, in particular coronary heart disease. Coronary heart disease means the blockage in the blood vessels, small blood vessels which run on the top of our heart, which give blood supply to the muscles of the heart and keep them healthy and make them keep pumping normally, makes the heart muscles pump normally, so that you maintain a good cardiac output and your blood vessels which come out from the heart can supply good amount of blood to all the organs in the body. Now what happens if there is a blockage in these coronary arteries, your heart pumping gets affected. In medical terms we call it as the ejection fraction. The normal ejection fraction is about 60 to 65%. But if you have a massive heart attack, it may come down to 15 to 20%. So this is severe LV dysfunction. Sometimes the heart may not be damaged so badly, it would come to say about 45-50%, then we call it as mild LV dysfunction. But what causes these heart attacks is more important, and how we can prevent them is very important. So the common risk factors are uncontrolled hypertension, uncontrolled diabetes, excessive alcoholism, smoking, stress, genetic factors, dyslipidemia, sedentary habits, and so on and so forth. A lot of people have early history of coronary artery disease in their family, like people getting heart attacks and coronary artery disease less than 40 or less than 35 years of age. This is also a very relevant factor. And then also, like we had COVID about 2-3 years back. So a lot of patients post-COVID had inflammation in their blood vessels which caused heart attacks. So inflammation is another very important factor which must be kept in mind, and inflammation of any kind can lead to heart attacks. So what can you do to prevent such heart attacks? Exercise regularly, eat healthy food, eat green leafy vegetable and fruits, and at least try and walk half an hour 4 to 5 times a week. Quit smoking. Alcohol consumption should at the most be mild to moderate, once or twice in a week. Then try to reduce your weight, and most important is control of hypertension is very important. If you have uncontrolled hypertension, it can lead to a lot of problems. It can affect your eyes, your brain, your kidney and your heart. Similarly, diabetes is a very silent killer. Uncontrolled diabetes, if you don't check it properly, if you don't take medication as advised by your doctor, can eat up all the vessels in the body, and it can cause severe blockages in the vessels of the brain, kidneys, heart and the peripheral blood vessels. Even vessels going to your heart and feet may be affected, and you could have infarctions in these vessels, and you could lose your limbs, your toes, and have a very bad eyesight because of diabetic retinopathy. So it's very important, and it is very easy thing. If you regularly follow up with your doctor, get your blood pressure and diabetes checked regularly and take medications as advised, you will have very less complications of diabetes and hypertension rather than if you don't take care of these things. So I wish you all a very healthy life. Follow these simple whatever suggestions I am giving you, and you can avoid getting all these complications like heart attack and unnecessary complications because of diabetes and hypertension. I thank you all for watching this video, and if you have any queries, you may contact us at Care Hospitals, Nampally. Thank you very much.